Hi, I'm Meg Starr, Managing Director and Global Head of Impact at Carlyle, and welcome to What's Next for Impact. This is a series that is exploring how we think that the pillars of impact will evolve over the next few years. Not where we are today, but where we're going. Today, I'm joined by my colleague, Erin Wurst, who leads Carlisle's Healthy Benefits Initiative, to discuss what's next for employee engagement. Thank you for joining us, Erin.
Thanks for having me, Meg.
So, Erin, we'll start simple. What do you actually do at Carlisle?
What would you say that you do here? Thanks for asking, Meg. As you know, we have a robust solution in place today to help our portfolio companies really focus on managing healthcare for their employees. This program already represents about 180,000 members across $1.4 billion in claims. And through this process, we've been able to save our portfolio companies about 50 to 70 million on average every year, despite the fact that healthcare costs continue to increase every year about 6 to 9%, according to Aon's annual survey, which we look at every year. We've started to expand our offering to include mental health solutions and other important progressive solutions that we think may raise costs in the short term, but decrease costs and increase employee engagement in the long term. It's the right thing to do for our companies and for our employees.
That's really interesting, Erin, because I feel like mental health isn't something that we always think of as top of mind when we're focused on employee engagement. So can you help us understand from a business perspective, why is mental health so important for businesses to focus on?
Yeah, absolutely. Supporting mental health has evolved over the course of the last couple of years from a nice to have to a necessity for a number of reasons. First, business outcomes are increasingly impacted by employee mental health. As employees make decisions based on a more holistic view of compensation and benefits, this is rising to the top. Second, it's our belief that mental health impacts physical health and burnout. This can be costly, both in terms of physical health claims that we talked about before, resulting from poor mental health, but also turnover catalyzed by this type of burnout and the cost of replacing talent. And COVID-19, thirdly, COVID-19 really amplified all of these trends. Reports of symptoms of anxiety and depressive orders, while it's sort of preliminary data, has been up in big ways. And we know that employee engagement issues are more important than ever, as we found ourselves here in the Great Resignation, right? All of those factors, it's really a symptom of mental health to some extent. And it's something that, we really have to focus on from a business perspective today.
That's really interesting, Erin, because it's clear that even though some of these healthcare interventions can feel like a short-term net cost, looking at the whole picture, it's really clear how that's actually a benefit for business long-term and importantly for employees. So it's clear that the importance and the prevalence of mental health has evolved significantly. Have you seen the world of mental health solutions follow suit?
The good news is yes. These changes have happened quite drastically, and luckily there's been a lot of innovation in the space. But just to take a step back, why is that innovation needed? And part of the reason is that the traditional set of solutions just, isn't sort of hitting the bar that it probably needs to. According to Lyra Health, 88% of health plan providers, they don't actually have any available appointments for mental health. And furthermore, one depressive case can cost well over $10,000, according to Spring Health. And, I think this is a really important statistic. The Society of Human Resource Managers reports that only 10% of employees are actually aware of and utilizing their traditional benefits around the mental health space. Finally, and unfortunately, a lot of employees either feel they will face stigmatization or actually do face stigmatization when they're looking for help within this space. But because of all the things we talked about before, that is changing, and it's changing very quickly. And one of the things that's most powerful about this is a proliferation of companies whose focus are on creating comprehensive solutions that are focused on mental health accessibility, cost reduction, and really holistic healthcare. And so all of those things together, I think, leads you to the idea that understanding where your employees are today, there is probably a solution that is best in class for those employees. And so if you can really make that match, there are definitely different companies across the healthcare landscape that are there to help.
Are there aspects of how businesses view mental health today that you think could maybe derail their efforts to really focus on employee engagement in the future?
Yeah, no, that's right. I think it goes back to like, do you view it as as a cost center, or do you start to look at it more as mental health as a part of your overall employee health? And I don't just mean physical health, which is an important aspect of mental health, but your employee's health in terms of their ability to be there on time, their ability to not be absentee, their overall level of burnout, and all of those different areas become increasingly important as you think about mental health in general.
That's really interesting. I like what you said, Aaron, about how companies really need to keep their ear to the ground to stay abreast of cutting edge developments. I actually joined a webinar that you hosted a few months ago presenting to Carlyle portfolio companies, walking them through new technologies, new services that you and your team had really identified as some of the leading practices, and particularly focusing on topics like culturally competent care, which I think is really important. And so I think finding ways to really share that information and make sure that companies know what's new, what might fit their particular companies and their employees is really helpful.
Thank you.
So now it's time to take our time machine into the future. What do you see as one path that companies could really focus on to engage employees on their mental health in a really positive and a creative way?
Yeah, no, I'm an optimist, and I really see companies starting to think about what that intersection between mental health and physical health really is, and seeing them as related as they are. In order to do that, step one is more clearly moving the financial thesis behind improving workforce mental health to the extent that we do on the physical side. So if we can navigate these two things together, integrated physical and mental health will become top of mind for employees, because ultimately that's what bears the cost. And a better mentally healthy workforce, much like a more physically healthy workforce, will be lower cost for the employer. There are questions to be asked around broader company strategy, the impact of mental health, and employee engagement. For example, as you mentioned, cultivating a more inclusive and open culture can provide a strong underpinning for improved employee mental health and improved culture. And so, taking the financial side along with that important aspect of a company's culture together can be extremely powerful. And ultimately, as noted, it is not a nice to have anymore. Employers need a solution, and employees are demanding these solutions. And really, there's two paths. The first is continuing to check the box, provide some form of mental health, and sort of really ignoring it at that level. The other more ideal option is to really lean into this aspect, not just to the healthcare benefit, but to engagement, productivity, and culture, and really overall employee wellness. I think ultimately, I talk to a lot of CHROs across our portfolio companies, and it's easy for us to sit and say, oh yeah, we definitely need this. HR professionals in general, of course we think mental health is important. But in reality, what we need to do is we need to convince not just the HR professionals, but those CFOs how important it is to the bottom line. And the problem is, how do you translate and solve that Rubik's Cube in a really fundamental, compelling way? So to get to that bottom line, we have to figure out how you can make this not just a CHRO conversation, not just a conversation about employees directly, but a CFO conversation and a CFO decisions where really we believe a number of things, right? Mental health increases engagement, decreases turnover, lowers healthcare costs. All of those things we can say out loud and believe are true. But now we have to really solve for that, to show that in data, so that when a CHRO comes to a CFO, the CFO says, no, I totally get it. I need this for the bottom line. I need this for my employees. I need this to make sure that we can be more successful as a company. And I think that, we're right there. And I think that that will be the difference between making this a priority for companies or having it continue to be something that's in the background.
That's really interesting. And I want to spend a minute just on that topic of data, Aaron, because I'm sure it's critical for actually understanding which solutions are effective, but I'm assuming pretty challenging to get. Can you talk through how we're thinking about data, where you're seeing it, what the challenges are?
Yeah, no, it is. It's a tough challenge, but it's one we faced before, with physical health. A lot of the important pieces of understanding physical health are things that we've cracked, right? And so, knowing which providers folks are going to, understanding from a claims perspective, how do you go out to bid from a pharmacy perspective, all of those things we've been able to gather data across 180,000 employees and really drive that focus, both from a CHRO standpoint to make sure that we're getting best in class care, but also from a CFO standpoint to see those savings over time. So really, we have to do the same thing. We just have to collect and create a different data set, right? We talked a little bit about employee engagement, turnover, absenteeism. All of those things have measurable real costs that we can start to look at. And if we start to put those measurable real costs against things like mental health access, against things like mental health engagement, against things like employee engagement, then we'll be able to tie those things really directly. And so when we talk then about and so I guess like that is what I get most excited about, is our ability to sort of prove the hypothesis that mental health care will improve financial outcomes. We've done it on the physical side. Now we can do it on the mental side. And when we are able to tie those things together in a real way, that is where this becomes a very clear conversation that and no longer a nice to have opportunity, but something that all of our companies will be interested in driving, because it drives the bottom line.
That sounds really powerful, Aaron. Aaron, I want to say thank you for joining us to talk about what's next in Impact, and in particular, not where we are today, but where we are going on employee engagement, and particularly with this focus on mental health, which, as we all know, is increasingly important. I'm personally very grateful for the mental health solutions that you've helped roll out for Carlisle employees, in addition to all the work you've done for a portfolio company. So thank you for the time, and we look forward to continuing to see what is next in your space.
Thanks a ton, Meg. I appreciate it.